On the Vaccine Watch, it's been exactly 1 week since Governor Kate Brown announced that Oregonians have a chance to win $1 million if they get vaccinated before June 27th.
But that $1 million incentive has that $1 million incentive helped increase vaccinations in the last week? That's the question. Newswatch 12's Brett Taylor asked Public Health Today. Joins us now with an update. So Brett, what did Dr. Jim Shames have to say about that?
Yeah, that's exactly right, Adam. I was able to speak with Dr. Jim Shames earlier on this matter. We'll talk a little bit more about that in a second. But actually, according to data collected by the Oregon Health Authority, since Governor Kate Brown made that announcement last week that Oregonians now have a chance to win $1 million if they get vaccinated, vaccinations have actually not only decreased across the state, but right here in Jackson County.
My personal expectation is that it's going to encourage many people to get vaccinated.
Right now, COVID-19 vaccinations are continuing to drop not only across Oregon, but right here in Jackson County. Since Governor Kate Brown's announcement last week that Oregonians have a chance now to win $1 million if they get vaccinated, vaccinations in Jackson County have plummeted by almost 30% compared to the previous week. And across the state, the 7-day average of vaccine doses has fallen to under 23,000 doses per day, something that the state hasn't experienced since late February. So has the vaccine incentive, or bribe in some people's eyes, caused more Oregonians to become hesitant to get the vaccine? Well, according to Dr. Jim Shames, that's not the case.
Remember that the whole reason for this program is that we've kind of picked the low-hanging fruit already. The people who are very eager to get vaccinated have been vaccinated.
Dr. Shames says that something like an incentive program will take some time before we possibly see vaccinations increase.
It require some degree of momentum. People talk to other people, they begin to talk among themselves, and an idea can sort of flourish over time.
But does acknowledge that there is the possibility that some people on the fence might be turned away.
We recognize that some people will be turned off by the process, feel like it's a bribe. It's a strategy. It's playing on human nature, and I'm sure it'll be successful for some people, and that's our goal.
Dr. Shames hopes, though, that those same people on the fence about getting their vaccine shot will decide to roll up their sleeves and get the vaccine as the pandemic continues on.
I just hope that those that are on the fence will realize the importance, because it's likely to come to them.
And others continuing to still get their shots to protect others.
Didn't want my mom to get the COVID-19.
Now, Dr. Shames also mentioned to me that it would be incredibly difficult to track if this incentive program has led to a vaccination decrease, because he says that they won't know whether or not vaccinations would have continued to decrease at its current pace, whether or not that vaccine program would have been initiated. Reporting live in Central Point, I'm Brett Taylor, Newswatch 12.
All right, thank you, Brett. And Oregon's vaccine lottery drawing will be next month. Right now, not all Oregonians are being counted.
Pat Doris explains why thousands of veterans are being left off the list.
Oregon's COVID lottery jackpot will include nearly everyone who got a vaccine from the first days through June 27th. It's nearly everyone because right now it will not include roughly 28,000 people, many of them veterans, who got their shot through the Portland VA. Nobody's too eager to talk about that on camera. But a VA spokesman said the reason is our system is not designed to transfer information that would be needed by external agencies, including the Oregon Lottery or OHA, for the purpose of getting Oregon residents entered into the lottery. The VA had a highly regarded vaccination program and got their supplies from the federal government, so it's not reported anything to the state in terms of who got the shots through their system. The same thing is happening in other states, including Maryland. A spokesman for Oregon's governor said, "We are working with the Oregon Health Authority to develop an alternative way to collect the information for Oregonians who received a federally administered shot." He added that the governor's office is confident they will fix the problem before June 27th, but so far there's no solution that they're willing to discuss in public anyway. Elsewhere, Thursday was going to be the last day the mass vaccination center in Portland at the Oregon Convention Center would give out first doses. But now it appears they may be getting Johnson & Johnson vaccines just in case someone shows up to help a friend get their second shot and decides they will finally get vaccinated.
We are working to move some Johnson & Johnson doses to some locations that are only doing second doses, basically to take advantage of somebody who happens to be there, transporting somebody else who's getting vaccinated.
Patrick Allen, director of the Oregon Health Authority, told lawmakers about the plan Wednesday. He also showed them this graphic. The top line is hospitalizations for people who tested positive for COVID. Look to the right side and you'll see where they recently climbed, leveled off, and are now mostly falling. This chart shows cases by day, also falling now. The state's latest report for the week of May 17th through the 23rd showed a 25% drop in the number of new cases from the previous week, hospitalizations down roughly 15%, and deaths down 40% compared to the week before. One thing that's up, wasted doses of vaccine, up to a total of 9,090. Allen, the OHA director, said it may be happening because the state is urging vaccination sites not to turn anyone away.
People showing up at a vaccination site toward the end of the day being turned away because the vaccinator didn't want to open a vial and waste doses. And we have tried to communicate very clearly, waste the doses.
The CVC at the Jackson County Expo will be operating on reduced hours on Memorial Day. Vaccinations will be available from 9 to 12. Walk-in and drive-through vaccinations are available and no appointment is needed.